If you want to predict who will develop heart disease, type 2 diabetes, or cancer the next 10 years, do not focus on their weight on the scale. Do not rely on their BMI. Instead, examine what is surrounding their organs now. Many people fixate on the number on the scale, believing it reflects their true metabolic health. After nearly 30 years studying how the body stores and burns fat, I have uncovered something that changes everything. You can appear thin, genuinely thin, and still carry the most dangerous fat in the human body. Fat that silently fuels cancer, constricts your liver, and releases harmful inflammatory chemicals into your bloodstream every single day. The fat I am referring to is visceral fat, and the 7 foods I am about to present have been scientifically shown to eliminate it. Most people believe losing body fat requires eating less, enduring cardio, and watching the scale decrease. But after nearly 30 years in emergency medicine and metabolic research, I have learned something that most doctors never share with their patients. The most dangerous fat in your body does not respond to general calorie restriction as you have been told. It responds to precise biological signals, and certain foods deliver those signals directly. The evidence is clear. You do not need to starve yourself to reduce visceral fat. You need to consistently eat the right foods. And the difference between those who successfully reduce their waist circumference and those who do not is not willpower. It is knowledge. Hello, I am Dr. Verena, an emergency medicine physician and metabolism researcher. After nearly 30 years of studying how the body stores and burns fat, I have observed patients follow every guideline correctly on paper. They reduced calories, exercised regularly, avoided processed foods, and yet still carried harmful levels of visceral fat around their organs. What I came to understand through decades of clinical experience is that we have been providing people with the wrong tools. We have been instructing them to focus on the scale when we should have directed their attention to their waist measurements. We have been promoting restriction when we should have emphasized activation. The human body is equipped with built-in systems designed to eliminate visceral fat. The issue is that most individuals have never been taught how to activate these systems. In this video, I will explain why visceral fat is fundamentally different from the fat you see in the mirror and why it is significantly more dangerous. You will learn about the specific biological mechanism your body uses to burn visceral fat and how nutrition directly influences this process. I will also share 7 foods, along with exact clinically supported amounts that have been scientifically shown to target and reduce visceral fat. Additionally, I will explain the preparation methods that determine whether these foods are effective or ineffective. You will also discover a precise daily routine you can begin immediately that has been shown to reduce waist circumference by up to 2 inches in just 8 weeks. Before we continue, a quick request. Many viewers have mentioned they watched several of my videos without realizing they were not subscribed. Would you take a moment to check? It is free, takes only 2 seconds, and helps this channel reach more individuals seeking reliable, science-based health information. Let me begin by explaining a concept that will permanently change your understanding of body fat. There are 2 entirely different types of fat in your body, and they function almost like separate organs with distinct effects on your health. Most people are only familiar with one type. The fat you can see and physically pinch on your arms, thighs, or hips is known as subcutaneous fat. Sub means beneath, and cutaneous refers to the skin. It is located just beneath your skin. It may influence how you appear in clothing. While having excess amounts is not ideal, from a metabolic perspective, it is relatively harmless. The second type of fat, however, is entirely different. It is known as visceral fat. The term visceral refers to your viscera, meaning your internal organs. This type of fat does not lie beneath the skin. Instead, it accumulates deep within your abdominal cavity, surrounding your liver, pancreas, intestines, and kidneys. You cannot see it, and you cannot physically grasp it. Here is the concerning reality. You can appear completely thin and still carry significant amounts of it. To better understand this, imagine your body as a shipping box, similar to one used by FedEx. Inside the box, you are protecting something fragile, so you fill it with packing material like styrofoam peanuts. A large volume of material can be packed into what appears to be a standard-sized box. From the outside, everything looks normal. But when opened, the box is tightly filled and under pressure. This is precisely how visceral fat behaves within your body. Whether you are thin or overweight does not change this reality. You can have a small or large frame, yet visceral fat accumulates internally, placing pressure on the organs it surrounds. What makes visceral fat particularly dangerous is its biological activity. Unlike subcutaneous fat, which primarily stores energy, visceral fat is metabolically active. It behaves like an abnormal endocrine organ, continuously releasing inflammatory substances known as cytokines into your bloodstream around the clock. These include interleukin 6, tumor necrosis factor alpha, and C-reactive protein. These compounds promote chronic, body-wide inflammation. This is where the situation becomes more serious. Think of chronic inflammation as glowing embers in a fire. A small number of embers may remain under control. However, if a microscopic tumor exists, just a small cluster of abnormal cells that your immune system has been managing, and these inflammatory chemicals are introduced, it is comparable to pouring fuel onto those embers, intensifying the fire. What may begin as a harmless cluster of cells can develop into aggressive cancer. The research linking visceral fat to at least 14 different types of cancer, including breast, colon, ovarian, pancreatic, liver, and prostate cancers, operates through this exact mechanism. Visceral fat does not remain inactive. It actively creates a biological environment in which disease can develop and progress. However, there is an even more important point to understand. Your body contains a built-in system specifically designed to burn visceral fat. Most people are completely unaware of its existence. The 7 foods I am about to introduce are the keys that activate this system. There are 2 primary types of fat tissue in the body, white fat and brown fat. White fat is the storage fat we have been discussing. Brown fat, on the other hand, is entirely different in both structure and function. It is not soft or loose in texture. Instead, it is densely packed with mitochondria, which are the energy-producing components of your cells. These mitochondria contain high levels of iron, which oxidizes and gives brown fat its distinctive color. Unlike white fat, brown fat does not store energy. It burns energy to produce heat, a process known as thermogenesis. The critical question is, where does brown fat obtain the fuel it burns? It draws this energy from white fat, with a strong preference for targeting visceral fat first. Brown fat is the only type of fat in the body that actively breaks down other fat. It functions as your internal metabolic furnace, and it can be activated through specific dietary signals. By understanding the biological mechanisms behind visceral fat reduction, you can better understand why these 7 foods are effective and how to use them properly for optimal results. The first mechanism is brown fat thermogenesis, driven by activation of the beta, 3-adrenergic receptor. Brown fat is activated through a specific receptor on its surface known as the beta, 3-adrenergic receptor. When this receptor is stimulated either through cold exposure or through certain nutrients, it triggers a protein within the mitochondria called uncoupling protein 1, or UCP1. UCP1 disrupts the normal process of energy storage. Instead of storing energy as ADP, the mitochondria release that energy as heat. As a result, your body temperature rises slightly and you may feel warmer. The fuel supporting this thermogenic process comes directly from visceral fat. Compounds such as EGCG found in green tea, omega, 3 fatty acids present in seafood, and capsaicin contained in chili peppers all activate this receptor through slightly different biological pathways. This is the primary mechanism through which these foods help eliminate visceral fat. The second mechanism involves addressing visceral fat as an inflammatory organ and effectively suppressing its activity. Visceral fat releases inflammatory chemicals into the portal vein, the blood vessel that carries blood directly to the liver. As a result, the liver becomes overwhelmed with inflammatory signals, begins to accumulate fat, and gradually loses its ability to regulate blood sugar effectively, triggering a harmful cascade. This cascade leads to fatty liver disease, insulin resistance, and eventually type 2 diabetes. Polyphenol found in foods such as berries, olive oil, and walnuts directly inhibit the production of these inflammatory cytokines. They reduce the activity of visceral fat as an inflammatory organ. Clinical studies measuring markers like C-reactive protein and interleukin-6 in individuals consuming these foods have demonstrated noticeable reductions within just a few weeks. This means you are not only reducing fat levels, but also shutting down the source responsible for producing harmful inflammatory compounds. The third mechanism involves reprogramming the gut microbiome. This is where the science becomes particularly compelling. A growing body of research shows that the composition of your gut bacteria plays a direct role in determining how much visceral fat your body stores. Certain bacterial species, particularly Akkermansia mucinifila and Lactobacillus gasseri, are associated with lower levels of visceral fat. When these beneficial bacteria are present in higher amounts, they produce short-chain fatty acids such as butyrate, which enhance insulin sensitivity and reduce fat storage. When these bacteria are lacking, visceral fat can accumulate even without excessive calorie intake. Fermented foods and those rich in prebiotic fiber help nourish and increase the population of these beneficial bacteria. Research indicates that consistent consumption of such foods can lead to measurable reductions in visceral fat within approximately 12 weeks. The fourth mechanism focuses on insulin sensitivity and the regulation of fat storage. When insulin levels remain chronically elevated, as commonly seen in individuals consuming high-sugar and ultra-processed diets, the body remains in a constant fat storage state. In this condition, it becomes difficult to access stored fat for energy, leading to continuous accumulation of visceral fat. Several of the 7 foods I will discuss directly improve insulin sensitivity through different biological pathways. Omega-3 fatty acids enhance cellular responsiveness to insulin, polyphenol and olive oil reduce insulin resistance, and the fiber found in walnuts and berries slows glucose absorption, helping to prevent spikes in insulin levels. When insulin sensitivity improves, a critical metabolic shift occurs. Your body is finally able to access and burn the visceral fat it has been storing. The research supporting these mechanisms is not merely theoretical. It has been rigorously tested in human studies, measured using objective tools, and published in peer-reviewed scientific journals. A landmark study conducted by Cornell University in collaboration with research institutions in Sweden followed 3,000 normal-weight women over a period of 13 years. These participants were not classified as obese. They appeared thin. At the beginning of the study, researchers used DEXA scans to accurately measure visceral fat, even though it was not externally visible. The findings were striking. Women with higher levels of visceral fat, despite having a normal body weight, had a 3-fold increase in the risk of developing breast cancer compared to those with lower levels of visceral fat. This represents 3 times the risk from fat that could not be seen externally. Another study from Tehran University of Medical Sciences involved 63 adults between the ages of 35 and 65 who had type 2 diabetes. Participants were divided into 2 groups. One group consumed 4 cups of green tea daily for 2 months, while the control group made no changes to their routine. The group that consumed green tea experienced a reduction of approximately 3 pounds in total body weight. However, the most significant result was the reduction in waist circumference. On average, participants lost nearly 2 inches, equivalent to about 2 belt sizes, even among individuals with established metabolic disease. This effect was attributed to the activation of brown fat through EGCG. A separate study conducted in Iceland examined the impact of seafood rich in omega-3 fatty acids on visceral fat levels. Participants consumed salmon 3 times per week for 8 weeks while following modest calorie restriction, resulting in weight loss of up to 15 pounds. Researchers then compared these results with a parallel group consuming cod, which contains significantly lower levels of omega-3 fatty acids, approximately 284 milligrams per serving compared to 1,565 milligrams in salmon. Even in this group, participants lost around 10 pounds. These findings demonstrated that even relatively small amounts of omega-3 fatty acids are sufficient to activate brown fat thermogenesis. The PRIDIME study, one of the largest nutritional studies ever conducted, included over 7,000 participants across Spain. The results showed that individuals who consumed extra virgin olive oil as their primary source of fat had significantly lower levels of visceral fat, reduced C-reactive protein, and decreased rates of cardiovascular disease compared to those following a low-fat diet. The key compound responsible for these effects, oleocanthal, acts as a natural anti-inflammatory agent. It has been shown to suppress the same inflammatory pathways as ibuprofen at the intake levels observed in the study. Additional research from Lund University and the Karolinska Institute followed adults who consumed fermented foods daily over a 12-week period. Participants with the highest intake of fermented foods demonstrated significant reductions in visceral fat, along with measurable improvements in gut microbiome diversity. Specifically, there was an increase in Akkermansia mucinifera, and these benefits occurred independently of total calorie intake. A separate study conducted by Tufts University provided one group with 1.5 cups of wild blueberries daily for 6 weeks and measured visceral fat using DEXA scans. The group consuming blueberries showed a statistically significant reduction in visceral fat, rather than subcutaneous fat, along with decreased inflammatory markers and improved insulin sensitivity. The anthocyanins present in blueberries were found to directly suppress the production of interleukin-6 by visceral fat. Now, here is the exact protocol: 7 foods with precise doses, preparation methods, and timing. This approach is supported by scientific research and is what I recommend in clinical practice. Food 1. Green tea or matcha, consumed at 3 to 4 cups daily. Green tea is among the most well-researched foods for reducing visceral fat. Its key compound, EGCG, epigallocatechin gallate, activates the beta-3-adrenergic receptor in brown fat cells, increases the production of UCP1, and inhibits the enzyme COMT, which would otherwise break down norepinephrine. By maintaining higher levels of norepinephrine, EGCG helps keep brown fat active for longer periods throughout the day. For preparation, heat water to approximately 175 degrees Fahrenheit hot, but not boiling. If the water reaches a full boil, allow it to cool for about 3 minutes before use. Steep the tea for 3 to 5 minutes, as this step is essential for optimal extraction. Avoid adding dairy milk, as the casein proteins it contains bind to EGCG and can reduce its absorption to approximately 20%. Plant-based milk alternatives such as almond, oat, or soy milk do not contain casein and are suitable options. Adding lemon can increase EGCG absorption by up to 6 times due to its vitamin C content. If you prefer matcha, 1 cup provides roughly the same amount of EGCG as 10 cups of standard green tea. Consuming 1 cup of matcha daily is sufficient to achieve the level of brown fat activation observed in clinical studies. Food 2. Fatty fish and seafood, consumed 3 times per week. The omega-3 fatty acids EPA and DHA found in seafood activate brown fat through a different biological pathway than EGCG. They bind to nuclear receptors known as PARs, which enhance brown fat gene expression and increase mitochondrial density within brown fat tissue. An increased number of mitochondria leads to greater thermogenic capacity, which in turn results in more visceral fat being used as fuel. Research conducted in Iceland demonstrated that as little as 284 milligrams of omega-3 fatty acids per serving is sufficient to trigger this effect, an amount commonly found in cod, one of the leanest fish studied. Therefore, it is not necessary to consume salmon daily to reach this threshold. You can obtain this amount from a variety of seafood sources, such as 4 medium Gulf shrimp, 8 oysters, a small portion of mackerel, or half a piece of halibut roughly the size of half a deck of cards. While salmon, sardines, and mackerel contain significantly higher levels of omega-3 fatty acids, consuming any type of seafood 3 times per week is sufficient. Food 3. Mixed berries, 1 cup daily. Blueberries, strawberries, raspberries, and blackberries are rich in anthocyanins, the compounds responsible for their deep coloration. These compounds directly suppress the production of inflammatory cytokines by visceral fat, particularly interleukin-6 and tumor necrosis factor alpha. In addition, they support the growth of beneficial gut bacteria that are associated with lower levels of visceral fat. A daily serving of 1 cup approximately 148 grams, is recommended. Frozen berries are equally effective and are often harvested at peak ripeness when their bioactive compound content is highest. They can be consumed with breakfast, blended into smoothies, or eaten as a mid-morning snack. The most important factor is consistency. Regular daily intake is far more effective than consuming large amounts intermittently. The anti-inflammatory and microbiome-supporting effects of berries are cumulative and require consistent exposure to maintain their benefits. Food 4. Extra virgin olive oil, 2 to 4 tablespoons daily. Extra virgin olive oil contains two primary compounds that contribute to visceral fat reduction. Oleocanthal acts as a natural anti-inflammatory agent, inhibiting COX-1 and COX-2 enzymes, the same pathways targeted by ibuprofen, thereby reducing the chronic inflammation associated with visceral fat. Hydroxytyrosol, another important polyphenol, promotes brown fat gene expression and enhances mitochondrial function within brown fat tissue. The PRODIME study utilized approximately 4 tablespoons daily as an effective therapeutic dose. This oil should be used as your primary source of dietary fat. It can be drizzled over vegetables, incorporated into salads, or used for cooking. However, it should not be exposed to very high temperatures above 375 degrees Fahrenheit, as excessive heat can degrade its beneficial polyphenol. Cooking at moderate temperatures is ideal. It is also essential to choose extra virgin olive oil, as refined olive oil lacks the polyphenol responsible for these health effects. Food 5. Chili peppers and other capsaicin-rich foods, 1 serving daily. Capsaicin, the compound responsible for the heat in chili peppers, stimulates thermogenesis through a pathway distinct from that of green tea or omega-3 fatty acids. It binds to TRPV1 receptors, which are responsible for sensing heat. When activated, these receptors signal the body to increase heat production by stimulating brown fat activity. This is why you may feel warmer after consuming spicy foods. Your brown fat is actively generating heat. Research conducted at Kyoto University provided participants with a daily dose of capsaicin equivalent to 1 hot pepper. After 12 weeks, there was a measurable increase in brown fat activity, along with greater reductions in visceral fat compared to control groups. It is not necessary to consume extremely spicy foods. Moderate options such as jalapenos, cayenne pepper added to eggs, chili flakes on pasta, or harissa in soups are sufficient to achieve these effects. Any source of capsaicin that produces a mild sensation of heat in the mouth is sufficient. If you experience severe acid reflux, it is advisable to consume smaller amounts with meals rather than on an empty stomach. Food 6. Walnuts, 1 ounce, 28 grams, daily. Walnuts are unique among tree nuts because they contain a meaningful amount of omega-3 fatty acids in the form of alpha-linolenic acid, ALA, which the body can partially convert into EPA and DHA. They are also one of the richest dietary sources of elagitannins, compounds that gut bacteria convert into urolithin A. Urolithin A has been shown to enhance mitochondrial function and specifically support the oxidation of visceral fat. A standard serving of 1 ounce is equivalent to approximately 14 walnut halves. Research conducted by the University of California demonstrated that adults who consumed 1 ounce of walnuts daily for 8 weeks experienced significant reductions in visceral fat, independent of total calorie intake, along with lower fasting insulin levels and reduced waist circumference. Walnuts should be stored in the refrigerator or freezer, as their polyunsaturated fats oxidize quickly at room temperature. If walnuts develop a smell similar to paint thinner, they have become rancid and should be discarded immediately, as oxidized fats can have harmful effects. Food 7. Fermented foods, 1 to 2 servings daily. Practical options include kimchi, kefir, plain Greek yogurt containing live cultures, miso, tempeh, and plain kombucha. The primary benefit of these foods lies in their impact on Akkermansia mucinifera, a gut bacterium that plays a direct role in regulating visceral fat storage. When Akkermansia levels are high, it produces compounds that strengthen the intestinal lining, reduce the entry of inflammatory substances into the bloodstream, and improve insulin sensitivity. When its levels are low, visceral fat accumulation becomes more likely. A typical serving of kimchi is approximately half a cup, while a serving of kefir or plain Greek yogurt is about 1 cup. When selecting Greek yogurt, choose unsweetened varieties and confirm the presence of live and active cultures on the label. Products that have been heat treated after fermentation no longer contain beneficial bacteria. Miso should be added to dishes after cooking or once liquids have cooled below 160 degrees Fahrenheit to preserve its probiotic content. Drawing from 3 decades of clinical experience, here are several important practical recommendations that are often overlooked. Tip 1. Combine green tea with seafood in the same meal. EGCG from green tea and omega, 3 fatty acids from seafood activate brown fat through different biological pathways, beta, 3 adrenergic receptor activation and PPR receptor activation, respectively. When both pathways are activated simultaneously, their effects are additive. For example, a meal consisting of grilled salmon or shrimp paired with a cup of green tea is more effective than consuming either component alone. Tip 2. Consume berries earlier in the day and fermented foods in the evening. The immune system and gut microbiome are most active during sleep. Consuming fermented foods at night allows beneficial bacteria more time to produce anti-inflammatory compounds and short-chain fatty acids, such as butyrate. In contrast, eating berries in the morning ensures that their anti-inflammatory effects are active during the most metabolically active part of the day. Tip 3. Stop eating at least 3 hours before bedtime. When your body is actively digesting a large meal, it diverts energy away from cellular repair, immune function, and fat-burning processes, all of which are most active during sleep. Closing your eating window by 8 p.m. and delaying your next meal until 8 o'clock or 9 a.m. creates a 12 to 13-hour metabolic fasting period that significantly enhances the effects of these 7 foods. While the foods activate brown fat, the fasting window provides uninterrupted time for brown fat to utilize visceral fat as a primary fuel source. Tip 4. Measure your waist circumference, not just your body weight. Measuring your waist at the level of your navel is one of the most practical ways to estimate visceral fat. Take this measurement once per week, on the same day, and at the same time, preferably before eating. A reduction of even 1 inch indicates meaningful visceral fat loss. A standard scale measures total body weight, including bones, muscle, water, and all types of fat combined. It cannot distinguish between harmful visceral fat and other components. It is common for individuals to lose several inches from their waist while seeing minimal change on the scale, especially if they are simultaneously gaining muscle mass. Tip 5. Preparation methods are essential and cannot be overlooked. For example, boiling broccoli can destroy sulforaphane. Adding dairy to tea can reduce EGCG absorption by up to 80%. Improperly stored walnuts can become rancid and lose their benefits. And excessive heat can degrade the anti-inflammatory polyphenol in olive oil. These are not minor details. They determine whether a food delivers its full therapeutic benefit or provides little to no effect. Proper preparation is a fundamental part of this protocol. Mistake 1. Inconsistency. This is the most common issue observed in practice. Many individuals follow a healthy routine for a few days and then discontinue it for extended periods. The 7 foods in this protocol produce results through cumulative biological effects. Brown fat activation strengthens over time. Gut microbiome changes require consistent daily intake to shift bacterial populations, and the anti-inflammatory benefits of foods like berries and olive oil depend on regular consumption. Typically, it takes around 30 days of consistent adherence to observe measurable reductions in waist circumference, and the effects become more pronounced after 90 days. Short periods of adherence, followed by lapses, interrupt this process. Consistency over a few days has minimal impact, whereas consistency over several months can significantly alter body composition. Mistake 2. Relying on the scale as the primary indicator of progress. Patients are often advised that the scale is not an accurate tool for assessing visceral fat loss. It is entirely possible to lose substantial amounts of visceral fat while seeing little to no change in overall body weight, particularly if muscle mass is being maintained or increased. This is, in fact, a desirable outcome, reducing harmful fat while preserving or building metabolically active tissue. Discontinuing the process due to slow changes on the scale can undermine long-term results. Instead, waist circumference and overall energy levels are more reliable indicators of progress. Mistake 3. Replacing whole foods with supplements. Products such as green tea extract capsules, fish oil supplements, resveratrol tablets, and anthocyanin powders contain isolated compounds without the supportive matrix of fiber, cofactors, and complementary bioactive substances found in whole foods. The research referenced in this protocol is based on whole foods and brewed beverages, not concentrated extracts. For example, studies involving blueberries utilized whole berries rather than processed extracts. Whole foods provide a complex nutritional profile that enhances absorption and effectiveness, which cannot be fully replicated by isolated supplements. Relying solely on supplements may therefore limit the overall benefits observed in clinical research. The seafood studies referenced involved the consumption of whole fish rather than relying solely on fish oil supplements. While supplements may provide some support, they cannot replicate the full biological complexity of whole foods. In nutrition, the combined effect of all components within a whole food is consistently more powerful than isolated elements. Mistake 4. Attempting to change everything at once. Many individuals try to incorporate all 7 foods simultaneously, completely overhaul their diet, begin intermittent fasting, and start a new exercise routine within the same week. Within a short period, often less than 10 days, they become overwhelmed and abandon the entire process. A more effective approach is to start with a single change. For example, begin by drinking green tea every morning. Maintain this habit consistently for 2 weeks until it becomes automatic. Then gradually introduce berries, followed by seafood, and continue building the routine step by step over 6 to 8 weeks. The end result remains the same, but the process becomes sustainable because each habit is established individually before adding the next. Having excess visceral fat does not mean that your situation is permanent. It does not mean your biology is fixed or that disease is unavoidable. Over 3 decades of clinical practice, I have seen patients significantly improve their metabolic health. These individuals were not genetically exceptional, nor were they always young. Many presented with established metabolic syndrome, elevated blood sugar, fatty liver, and steadily increasing waist measurements over several years. They were not extraordinary individuals. They simply applied small, specific actions consistently, activating their body's natural fat-burning systems each day. Not perfectly, but consistently. Brown fat already exists within your body. The beta, 3 adrenergic receptors that activate it are functional at this moment. The gut bacteria that influence visceral fat storage are present within your microbiome, awaiting the right nutritional support. The anti-inflammatory pathways that suppress cytokine production from visceral fat are also active and ready to respond. These biological systems are already in place. You can begin activating them today. To summarize the key points covered, first, visceral fat is a metabolically active form of fat stored around your internal organs. It is not visible externally, but can be estimated through waist circumference. It contributes to conditions such as multiple cancers, cardiovascular disease, type 2 diabetes, and fatty liver by continuously releasing inflammatory chemicals. Second, the underlying mechanism involves brown fat, which is primarily located in areas such as the neck, upper back, and between the shoulder blades. When activated, brown fat uses visceral fat as a fuel source. The 7 foods discussed activate this process through well-documented biological pathways. 3. Food 1 green tea or matcha. Consume 3 to 4 cups daily, brewed at approximately 175 degrees Fahrenheit, and avoid adding dairy. 1 cup of matcha provides the equivalent of about 10 cups of regular green tea. Adding lemon can increase HCG absorption by up to 6 times. This activates brown fat through the beta, 3 adrenergic receptor, and UCP1. 4. Food 2 seafood, 3 servings per week. Options include salmon, cod, shrimp, oysters, and mackerel. Only 284 milligrams of omega, 3 fatty acids per serving are required. These activate brown fat via PPR receptors and improve insulin sensitivity. 5. Food 3. Mixed berries, 1 cup daily, either fresh or frozen. This includes blueberries, strawberries, raspberries, and blackberries. These reduce the production of inflammatory cytokines by visceral fat and support beneficial gut bacteria. 6. Food 4. Extra virgin olive oil, 2 to 4 tablespoons daily as your primary fat source. It contains oleocanthal, an anti-inflammatory compound comparable in effect to ibuprofen at therapeutic doses, as well as hydroxytyrosol, which activates brown fat gene expression. 7. Food 5. Chili peppers, 1 serving daily. Options include jalapenos, cayenne, and chili flakes. These activate TRPV1 heat receptors and stimulate brown fat thermogenesis. Consuming them with meals can help minimize gastrointestinal discomfort. 8. Food 6. Walnuts, 1 ounce or approximately 14 halves daily, stored in a cool environment. They are rich in alea-omega, 3 fatty acids, and allagitannins. These compounds are converted into urolithin A, which enhances mitochondrial function and supports visceral fat oxidation. 9. Food 7. Fermented foods, 1 to 2 servings daily. Options include kimchi, kefir, plain Greek yogurt with live cultures, miso, and tempeh. These promote the growth of Akkermansia mucinifera, a key gut bacterium involved in regulating visceral fat storage. 10. To enhance the protocol, combine green tea and seafood within the same meal. Close your eating window by 8 p.m. and delay your next meal until 8 to 9 a.m., creating a 12 to 13-hour overnight fast. This provides brown fat with uninterrupted time to burn visceral fat. 11. Measure progress accurately. Track waist circumference at the level of your navel once per week. A 1-inch reduction indicates meaningful visceral fat loss, while a 2-inch reduction reflects a significant metabolic improvement. The scale alone is not a reliable measure. 12. Timeline. Consistent adherence for 30 days can produce measurable changes. 90 days can deliver substantial results, and 6 months can lead to a complete metabolic transformation. Your health is not solely determined by genetics or age. It is strongly influenced by your daily dietary and lifestyle choices. You have far greater control than you may have been led to believe. If you found this information helpful, consider doing 2 things. First, share this content with someone who may benefit from it, as metabolic syndrome affects a large portion of the adult population. Second, explore my previous videos, where I discuss the most harmful foods contributing to visceral fat accumulation, many of which are commonly found in everyday kitchens. I look forward to seeing you in the next video.